Welcome to Usmle Point. Right now the time is 2 a.m. I'm a bit drowsy, but don't worry. I will tell you the important points that will help you for a Usmle examination. Let me start with this Klinefelter syndrome. This is very important topic for USMLE examination. You should know all the clinical symptoms, signs, treatment and lab tests. Very important points. I'm going to discuss very important points. Let me start with this, a Klinefelter syndrome. In 1942, once they reported a case report in which 9 men who had enlarged breasts, sparse facial and body hair, small testes and inability to produce sperms. This is how they presented, and later they found out to be a Klinefelter syndrome, that is 47XXY, right? Oh, I'm doing great. Okay, 47XXY. More number of X, more problems, remember. I'm just kidding. Okay, most common chromosomal disorder associated with the male hypogonadism and infertility. Most common. Okay. Okay. The important points what you need to remember is hypogonadism. These patients will have a small testes. Either it can result in azoospermia, no sperms, or oligospermia, few sperms, gynecomastia, that you know, most of you know, psychosocial problems, very important, and halonization and fibrosis of seminiferous tubules and elevated urinary gonadotropins level. These are the things in general what you see in the patients with characteristic symptoms of Klinefelter syndrome. Let's move on to next slide. Okay, how do they present? They present with the fatigue, weakness, erectile dysfunction, osteoporosis. Remember, very important is the osteoporosis. Sometimes they give the history of Klinefelter syndrome, and in USMLE they will ask which of the following could be seen in this patient. Osteoporosis is very important. Okay, language impairment, academic difficulties and subnormal libido. Okay, initially they will have a normal IQ, remember this. As the disease progresses, they can have this language impairment, academic difficulties, but this also depends on the number of X chromosomes also. Okay, sign and symptoms: reduction in the gross and fine motor skills, coordination, dexterity, running inability, poor muscle tone, strength, synkinetic movements and tremors. These are the what you can see in the Klinefelter syndrome, but usually you don't see these things in USMLE examination. Okay, so the important thing is associated osteoporosis. This is very important, what you need to remember. And there is a high chance of patients having diabetes mellitus, obesity, metabolic syndrome, hypothyroidism, Sjogren's syndrome, rheumatoid arthritis, systemic lupus erythematosus. Okay, what else you can see? Most of us know only symptoms, few symptoms of Klinefelter syndrome, but other things what you need to know, you should know, because in a step 3 they might confuse you, right? So you should know all the symptoms. I made out the list of important symptoms for you, so try to write it down and memorize. Definitely it will help you. Okay, ulceration of the skin, hypoplastic ulceration, deep vein thrombosis, very important. So when a patient of Klinefelter syndrome, you're giving treatment, then you should think of taking coagulation profiles and doing scans to prevent, and giving warfarin to prevent DVT in the patients. This is very important. Okay, clinodictyly, very important. Normal intelligence, as I said, normal intelligence initially, later they can have decrease in the intelligence IQ, but well, it also depends on the number of X chromosomes. Enlargement of the molar teeth by an extension of the pulp, you can remember or you can forget, that's okay. Lack of secondary sexual characteristics, very important. So that's why, this is because of these reasons most of the patients are not diagnosed during pre-pubertal. Okay, once they are reaching pubertal age, then they will come with the signs of gynecomastia, with small testes, okay, loss of inability to with erectile dysfunctions. These are the signs and symptoms what you can see. Okay, most of us know gynecomastia, right? Most of the patients with the Klinefelter syndrome present with the gynecomastia, 20 times more risk for carcinoma, right? Breast carcinoma, they are more risk general population compared to male. In males, compared to males, normal male, they have 20 times more risk for carcinoma, breast carcinoma. Remember, 20 times, very important. Testis size, sometimes what they will do, they will not give the testis size is small, they will give testis size of 9 ml, 8 ml. So you should remember less than 10 ml is a small testis size. Mitral valve prolapse can be seen in heart, if it involves the heart. Okay, so you need to do echocardiography. Okay, important lab findings you should know. Testosterone is low, right? Because testes are small. LHFSH should be high, right? Because testis is not working, so LHFSH level will high. Estradiol again high. Urinary 17 keto steroid low or a normal. This is the extra point what you need to remember. Most of us know testosterone, LHFSH and estradiol. Okay, remember about the third point also, fourth point also. Treatment, how do you treat? For Usmle, just remember testosterone replacement is more than enough for you. If the patient presents with the gynecomastia, treat with a mastectomy. Okay, that's it. This is about the Klinefelter syndrome. Thank you for watching my video. Please do subscribe.